Hey folks, welcome to the Transplant Helper today. My name is Jim Merle. Today we're going to be beginning a brand new video series entitled the Transplant Evaluation Process. Now, if you're like I was maybe 8 or 9 years ago, I really didn't have any idea there was an evaluation process. As a matter of fact, I probably just assumed then that if a doctor decided I needed a transplant, he would list me, I would get it, and the story would be over. But I learned the hard way there's an awful lot more to the evaluation process than first meets the eye, than you would first assume. And so we're going to be discussing that over the course of the next few weeks. As a matter of fact, as we go through this, hopefully, whether you're a pre-transplant patient who's just wondering what's about to happen, or a post-transplant patient who's looking back, kind of going, what in the world just happened? Hopefully, we're going to clarify a lot of those and give you some answers to those questions as we go through. So stay tuned not only today, but throughout the course of maybe 3 or 4 weeks, however many I decide to do in this series. But nonetheless, we're going to get around to most everything, I hope, during our discussion. Let me ask you right now, if you've not already subscribed to this channel, how about go ahead and click the subscribe button right beneath this, maybe even hit the bell notification right beside it so that you'll be notified when each of these consecutive videos come out, even in this series, for example. But with that said, today we're going to be discussing the topic of the transplant evaluation / a grueling process, because the evaluation itself is a part of the whole process, but I think it's one of the most grueling. As a matter of fact, I was talking to someone just a few hours ago on Facebook about the topic, and she pointed out to me that it was probably harder to go through the evaluation than it was even to go through the surgery itself as it would come. And of course, you can assume why that might be. You're asleep for the surgery and most likely not for the evaluation, but nonetheless, I think it is a difficult part of the whole process together. So we're going to be mentioning today the reasons why it can be grueling, and they're basically only 2. One is the time frame that's involved. My transplant center, for example, when it comes to a heart transplant evaluation, they tell all of us patients in the beginning, before anything begins, that you're going to have to go through 3 to 5 days of evaluation in order to get through the process. Now, someone says, well, that's no big deal. You know, you go to clinic a day here and a day there, and before it's over, you're done. Well, they're not talking about that. They're talking about going to the clinic, staying there from can to can, from daylight to dark, from open to close of the doors, and going through testing and evaluations the entire time. And really, that 3 to 5 day period is a minimum, and that's based on your body at that point being able to endure that much testing over 3 to 5 days and not having to pause and rest and not having scheduling difficulties. Also, I've had one friend just about a year or so ago that was going through the eval for a lung transplant. I think hers took over a month to get done because of some scheduling issues and because of her body really not being able to hold up long enough to go through it all at once. And by the way, if you're able to do this inpatient, that's better because you can be in the hospital bed. They can pull you in and out for tests anytime, day or night, as opposed to you driving to your transplant center, sitting in clinic in a waiting room and going from test to test. But, you know, that's neither here nor there. It is a grueling process because of the time frame that's involved. Second, it's a grueling process because of the tests that are involved. There are a lot of tests that are involved in any transplant evaluation. I'm going to be using a heart transplant eval today, for example, but let me tell you, the things we're discussing here are going to apply to most any of us, because basically when they do an evaluation for any transplant, they're going to be looking at you from the top of your head to the tips of your toes. They want to know everything they can get to know about you to make sure your body is in order and it's well enough as well as sick enough to need the transplant at the same time. As a matter of fact, one of the things they're looking for during the transplant is not just for if that particular organ has failed and how much need there is. They're looking to see if the rest of your body is healthy enough as a package to go through and recover from a surgery. They're also looking at, during the evaluation process, whether or not this is going to improve your quality of life. And that's one of the reasons why I personally went through the evaluation process 4 times, because the first 3 times they judged, you know, we don't think you're quite sick enough yet to require a transplant, transplant, and they decided that my quality of life post-transplant may not be any better than I had pre-transplant. Of course, when you get very sick pre-transplant and you're going down fast, then they can decide, anything will be better than this, and they might go ahead and list you. But let's get down to the specific testing. Again, whether you're heart, lung, liver, kidney, pancreas, whatever, some of these tests are going to apply, but I will be using the heart transplant as a for example. I'm going to pick up my notepad here because I don't want to remember. And by the way, I want to thank my pre-transplant coordinator, Yen Dibble, for providing me with a 2017 transplant eval pack from UAB Hospital just as a reference. I've done a lot of research aside from that, and I'm kind of combining it here in this package. But here's just some of the testing. I'm going to look at about 17 of them, and don't keep count, because if I miss one or skip one, I'm not too worried about it, and you shouldn't be either. But there are 17 tests and evals that are listed here that all make up that one eval, which is decided if you need a transplant. And it begins with, for all of us, it begins with lab work. And I mean by that a lot of lab work, from blood typing to tissue typing to testing for certain diseases like hepatitis A and hepatitis C and AIDS and all these things. You've got to get a lot of blood work taken. As a matter of fact, I can remember the very first time I went in for the evaluation blood work, and it was so different than anything I'd ever experienced. Before that, I went in for blood work at a doctor. They pulled 4 or 5 vials about this big, and we were done. My first evaluation, they pulled 34. I'll say that again, 34 vials of blood and 4 culture bottles, which are about the size of a cough medicine bottle, out of both arms, because they had to get all that blood at one time. I remember thinking, you know what? I should have just donated blood, and then they went and got it from them and did all their testing. But that's not the way they do it. They're going to draw a lot of blood, and that blood's not only going to come from your veins, which are, just normally where they would draw. Some of that's going to be arterial blood, because they're looking for blood gases, the levels of carbon dioxide, I should say, versus oxygen. A lot of things are going in after. So it can be very difficult and even painful just for those lab draws. In the second place, the second test listed here, and this is pretty much universal too, and that is they will do probably an abdominal ultrasound. Now you say, now wait a minute, if you're a heart transplant patient, what do they care about your belly? Well, they care about your belly a lot because all of your organs, all major organs, go from your head to your waist. Everything's right in here, and it all connects and works together. It's a system. And so they're looking in at your bile ducts, at your intestines, at your gallbladder, at your stomach. Everything works together, and they're looking in there to make sure that there are no abnormalities, there are no problems, there are no cancers, for example, that everything's working and is in working order, except for maybe that one organ, like for me, which was a heart, to make sure, it's failing, but the other things are holding up. So they'll do an abdominal ultrasound, the little probe with a jelly, like you're having a baby or something. That's what they're going to do. The next place here, number 3, it lists chest x-ray and sinus x-ray. And again, you obviously know what they're looking for in an x-ray. They're looking for actual bone structure, for skeletal abnormalities too, but they can also see several major organs like your heart when they look at it with a certain power of ray, I guess you'd say. They can see your heart, see how enlarged it is, where it's positioned, that sort of thing. And a lot of your transplant evaluation really has to do with finding out cavity size. Now, someone told me one day, said, oh, well, they transplant you according to blood type, tissue type, and body size. That's actually not true, because I'm 6'1". I weigh about 175 pounds, but there are many people who are 6'1" who weigh, say, 200 or 230 or 40 pounds. And so if you put us side by side, you might say, well, that guy's a lot bigger than you are. Not the case. We may have the same cavity size, chest wall cavity size, and need for basically the same size heart or same size lungs or whatever. And so they're looking for a cavity size, and they're going to help to find some of that on the basic x-rays. They're also checking out your sinuses and such, just looking for infections, for abnormalities like with everything else. Next on here, number 4, there's something called a VQ scan. Now, a VQ scan is basically where they put some radioactive type dye into your system, and where they can see your lungs and your whole pulmonary system working kind of in time, or in real life, in the moment, live, I guess you'd say. And while they're doing that, they're pumping your body full of either high oxygenated levels levels or carbon dioxide levels and such, and they're seeing how your body's reacting to that, how much oxygen you're inhaling and exhaling and such as that. And again, you may have that with a lung transplant, you may have with a heart transplant, but you may have it with other transplant evaluations too, because that's a major organ. It's a part of that system. So a VQ scan. Next here, number 5 is listed, a DEXA scan. Now, a DEXA scan is very important for any of us because it's a bone density scan. Basically, they lay you out on the table. I think if I'm remembering right, you breathe in some radioactive material there, then they lay you out on the table, scan your entire body from, again, head to toe, and what they're looking for is bone density. And that really matters more than you think, because when you get post-transplant and you start taking a lot of the drugs and medications that we're on, it can really affect your bone density. So they need to know where you started at, where you're at right now, so they can really see where you're going to be going in the end. The next place here, number 6, is listed something called a MUGA scan. A MUGA scan. Now, that's hard to discern, but I'll tell you, MUGA scan is probably going to be primarily for the heart transplant patient. Again, someone else can have it, but a MUGA scan is similar to the VQ scan in that they inject into you some radioactive dye, and then they can slide you under an X-ray type machine, a scanner, and they can see your heart pumping in real time, and they can see the blood flow. And what they're checking for here primarily is something called the ejection fraction, or the cardiac output. They're looking for that to determine, again, how well your heart is functioning, and really decide if you're in need of, or you're even a candidate for a transplant. So you may go through a MUGA scan. And the next place here, number 7, which again, primarily to the heart, but can apply to others, an echocardiogram. That's very similar to what we mentioned earlier, the abdominal ultrasound, but now they take the same ultrasound type machine and they run it around your heart. And again, they're looking for sizing, they're looking for blood flow, they're looking for measurements of the heart itself to see, okay, here's what he's got, so this is kind of what he's going to need in the end. And it's a very, very important test, by the way, one that you'll endure hundreds of times pre and or post transplant if you're a heart transplant patient. Next place, number 8, an echocardiogram. Primarily heart transplant again, a transplant patient again, but the EKG or echocardiogram gives them a little short snippet of the way your heart's functioning. It can detect arrhythmias, if I can say that, different missed beats and such, and really give them a lot of information. I'm shocked. My brother is an ER nurse. He happens to be very good, at least it seems, in the echocardiogram or EKG area. And he's told me some things that they can catch by that, 3 or 4 second catching of the beats that really give them some insight. Nonetheless, part of the test. Number 9, a left and right heart catheterization. Again, primarily heart. Someone might need that for any case, but a heart catheterization is where they go in, they do that sometimes with and without contrast, most of the time both, and they go in either through your neck, your wrist, or your groin. For the left and right combined, they'll need to go in through your groin for that, but they'll come up and they'll run catheters up through your heart, into the heart itself. They'll look around for pressures, primarily for ejection fraction again, but for heart pressures. They're also looking, as they go through, they can run cameras and balloons and place stents and do all sort of things through that process, but they're trying to determine, again, overall heart function and whether or not your arteries are clear, that sort of thing. So many people have heart caths for any reason, but here it's for the evaluation process. The next place, number 10, the complete pulmonary function test, or PFTs, with arterial blood gas. This is the dreaded test for me. I was having problems pre-transplant, like many cardiac patients would, with actually breathing or keeping my breath during exercise. Well, when they take and put you on a bicycle, on a treadmill, or they even had a booth, I don't know what this was about. They put you in an airtight booth and they give you a limited amount of oxygen or a limited amount of carbon dioxide, and they see how your lungs are going to function in that. Oh, it's grueling. I mean, you think you're going to die. You think they're going to cause your lungs to burst or collapse. But again, they get a lot of information from that pulmonary function test. And a lot of times, if it's a cardiac patient, they learn there that they may not only need a heart transplant, but also a heart and lung transplant, or vice versa during that process. Sometimes cardiac symptoms actually turn out to be pulmonary problems when they divide that up. And then number 11 may seem strange to you, but you'll be called on to get a dental evaluation. They want to know about the health of your teeth. And if you've ever been sitting down with a nerdy dentist, I guess you call them, a lot of times they'll look at your teeth and they try to tell you an awful lot about your life, which they can, from the shape of your gums, not the shape, but the condition of your gums and such. They can tell you a lot. But dental hygiene is very important to a cardiac patient. Plaque, that sort of thing, needs to be rid of as best we can, because that can cause some dangerous problems a little bit later. So you'll be called on to do a dental evaluation, most likely an eye evaluation. That's not listed here, but I know it's part of it, because they want to have baselines on these things, because some of the medications will cause your eyes to deteriorate post-transplant. So they'll get some baselines. Number 12 is what I'm looking at here, a neuropsychological consultation. That's a big fat word to basically say they're going to see if you're have any mental illness, if you're having any problems with mental illness or any past or history of that, because it's very important. We're going to take an entire episode just about this later, but it's very important that you're ready to mentally endure the transplant. It's one thing to go into surgery, come out of surgery, and get up and walk. It's another thing altogether to deal with all the emotions and the stress. And I've already done programs about the emotional experience. I'll try to link up here or down below about depression, that sort of thing, which is possible. I'm going to be doing an episode soon about PTSD, because that's even outside with a slight possibility for any of us transplant patients, because of the traumatic experience itself. But they're going to do a neuropsychological consultation. Number 13, a social work consultation. That's extremely important. We'll mention that again, I think maybe on next week anyway. But deciding if you have the funds to pay for a transplant, if you have the support system, as in family members and friends who can help out, you're going to be able to afford the medications and the post-transplant treatment, all that. That's a social work consultation. Number 14, the transplant coordinator consultation. This is where you sit down and meet your pre-transplant coordinators. Maybe you're introduced to the post-transplant coordinators you might eventually have, but you really get to know that person, because they are going to be your right-hand man or right-hand woman for the whole process. They're going to be the mediator, the go-between you and all of your health care for probably the rest of your life. And my coordinators, Yin Dibble, which gave me this packet. She's a great friend of mine from pre-transplant days. Connie Bowen is my primary coordinator now, but others, Allison Hayes, also Sabrina, all those great people. They're a huge help. But you get to know them, get to meet them. Number 14. Number 15, the transplant surgery consultation. Now, for me, this wasn't a big deal. It was a big deal, but when it actually happened, I probably met the transplant surgeon for like 3 minutes. But this is not your cardiologists, or not your pulmonary doctors, or not your renal doctors. These are the doctors who are actually going in and doing the surgery. And they're going to discuss the surgery itself, probably be very technical with you, but they're going to tell you about the surgery, what's going to be involved, and so that'll be part of it. Number 16, the heart failure consultation. Again, this is just for hearts, obviously, but explaining to you why you're in failure, what they're diagnosing you with, and how they're hopefully going to improve that in the end. And then number 17, the nutrition consultation. Now, nutrition will also be involved in exercise or recovery, but nutrition is a biggie. Both pre and post-transplant, having a better diet, a healthier diet, a diet that's going to help you to really recover quickly and survive better, all that's going to be a big deal. And they're going to give you all the tools needed in order to put that whole package together before this thing is over. And that's 17 tests. There are many more that you could endure. These are the 17 major tests that you'll go through in a transplant evaluation process, particularly for the heart, but again, could really go for anyone. So what are we talking about today? Transplant evaluation is a grueling process. It's a big deal to go through it, whether it be from the time frame that's involved or from the actual tests that are involved. The evaluation process is a big deal. So I just wanted to make this program to hopefully prepare your minds for that, or to settle your minds on what just happened in your past, but really to give you an idea of what's going on. We're going to make some consecutive episodes here where we're going to talk about some other aspects of the evaluation process. When that comes about, I'll keep them linked here in the show notes below as best I can. But anyway, at this point in time, I certainly appreciate you joining me today on the Transplant Helper. I hope that you'll take time to like, subscribe, and share, maybe hit the bell notification, whatever. But really, what I want you to do is continue to build this community. Comment below. Tell me about your transplant evaluation process. Was it similar to this? Was it much different than this? Whatever you want to do, just tell me, hey, I agree or I disagree. It makes no difference. Anyway, I certainly appreciate you watching. And until next time, stay stronger, friends.